Does really genetics play a role in speech therapy also, sir?
Yeah, genetics produces conditions basically like Down syndrome and other neurological condition can be genetics, but environment plays a very vital role because if the environmental is missing, they get develop what is known as a garden variety of mental retardation because there is no stimulation. So nowadays, with both husband and wife working, child being left alone, they develop this delayed speech and language patterns. A significant amount of people learn this. People who are exposed to multiple languages at the very younger age, they also have this problem of getting mastery in one language basically. And especially those children who are normal but they are not exposed to the speech and language linguistic environment, they face this problem. So genetics has a role to play, and that condition is at the time of birth, but environmental is postnatal plays a very significant role. So it is advisable that the child should be exposed as much as possible. For a simple consideration, a child in a village is exposed to a lot of linguistic abilities. He moves around different houses, different shops and all these things. He has more linguistic capabilities than a child who's in the city locked up in a house or a room, because early exposure is very important. There is a concept called critical age. So the brain has a maximum development till the age of 3. That is about 40% to 45% of the brain is developed, where language is related to the brain development. From 3 to 7 years, 60 to 65% of the brain is developed. From 7 years to 13, the remaining 15% is developed. Then the 15% is developed by experience. That's why one of the educational authorities have planned the education that we all study board exam till 14 years, SSLC. Then we branch out into different discipline, like we become doctors or we become engineers or whatever it is. So, but the common entrance exam and all the students pass through the same phases. So this early phase between 0 to 4 or 5 years, if it is deprived for the child, then the speech disorders are very significant in this sort of children.
Why children don't speak?
Children don't speak. One is because of the genetic issues. Second thing is, if they have a hearing loss, if it is not attended upon, the child cannot hear. We learn to talk by hearing. So if the channel is cut off, the child will not able to pick up. The third thing is auditory and speech deprivation. As I told you, if a child is locked up, or the child is not being stimulated with the speech, if there are no people to talk to him, he does not develop speech and language. The fourth consideration is always the medical conditions play a significant role.